Welcome back to the DRH show. I'm delighted to have a leading voice in men's health and diabetes care. He is a physician with years of experience specializing in type 2 diabetes, metabolic health, and men's health. As the founder of Man Strong 2, he has helped redefine how men approach preventive care and long term health management. His work bridges the connection between internal health and what we see on the skin. He raises awareness about how diabetes can affect not just the body, but also a man's confidence and a sense of well being. Through his clinical insight and public education work, he's become a trusted advocate for spotting the hidden signs of diabetes early and taking action for better long term health. Dr. Suren Naidoo, thank you for joining us today.
Thank you, Dennis. I'm really pleased and welcome, and thank you for the lovely introduction and welcome to your show. I'm really honored to be on your show and look forward to discussing how
Mhm,
our skin conditions are affected by diabetes,
mhm,
and we will focus mainly on
mhm.
how how to recognize early signs of skin disease and how that can affect how this will go on to affect diabetes.
Yeah, very important topic, Dr. Suren. So you've built a respected career in men's health and diabetes care. So what first inspired you to focus in this area of medicine, and what led you to establish Man Strong 2? So can you give us a bit of background, your trajectory in life, and how you ended up doing what you're doing?
Well, I mean, medicine's always been in our family. But more importantly, we have a family history of diabetes. And as a young boy, I witnessed my grandparents suffer with diabetes, mainly on my maternal side. My mom had diabetes. And as Asians, we are prone to have diabetes. So as a result of that, I thought to myself, when I qualified as a doctor, I worked mainly under an endocrinologist in Ireland. And when I came to England to do my studies and general practice, I then went on to specialize mainly in diabetes and cardiovascular medicine because both go hand in glove. So in terms of diabetes itself, it's such a chronic inflammatory condition, which I can talk to you about in more detail. But what really inspired me is how I can prevent patients suffering with severe side effects of diabetes, like cardiovascular medicine, skin conditions, amputations of the toes, and so on. And I've actually witnessed this firsthand in my own family. And this has really inspired me to see how I can improve things and help my own self and from preventing becoming a diabetic myself.
It's really clear that it's not just professional path for you, but something deeply
Personal.
personal. And I could really understand it being Asian myself. I know a lot of family members. In fact, I also have pre-diabetes myself. I'm pre-diabetic myself, rather. Now,
Really.
speaking of that, could you tell us a bit about more about your journey as a physician and what led you to establish Man Strong 2.0? And also, if you could also talk a bit for those who may not be familiar, how exactly does diabetes affect the skin?
Right. So I worked for many years, 35 years of experience in diabetes and cardiovascular medicine in my general practice years. Once I've left or resigned rather from general practice, I then went into private medical practice. And during those years of general practice, I used to look after patients mainly with diabetes and their complications. And common complications of diabetes are skin conditions, and which can lead to ulcers, can lead to gangrene of the feet, and amputation of toes. And also I've seen so many patients suffer with cellulitis because of acute infection of the skin from diabetes, especially uncontrolled diabetes. Another important complication of diabetes was the people who were getting heart attacks. And I noticed a lot of patients sometimes would get silent heart attacks, not realizing that they are having an heart attack, especially if you have mild heartburn or indigestion, and they may not understand that this is actually impacting on the heart. So I then created Man Strong 2, a program to educate and to help patients understand what is really going on in terms of the vascular system. And another common problem is erectile dysfunction, where patients who develop erectile dysfunction as a complication of diabetes, 2 to 3 years later, they're more likely to develop a heart attack. So this spurred me on to actually go in and start Manstrong 2.
Mhm. Mhm. So, Dr. Naidu, you've really painted a kind of vivid picture of how interconnected everything is, that diabetes isn't just a number on a glucose chart, so it shows up in many unexpected ways. So, from your experience, how common are skin problems among people living with type 2 diabetes? And could you also explain why do they occur?
Now, type 2 diabetes presents in lots of different ways, and the commonest things are skin infections. People will present with simple infections, and these infections could be recurrent. For example, skin boils, furuncles, people having skin infections in the genital area or warm folds, especially fungal type of infections. And sometimes these go on to develop serious conditions like ulcers, and ulcers which don't heal especially. Uh, Also, patients will find that they may, in the early stage of diabetes, they may just present with fatigue, lack of energy, no interest in life because they're just exhausted. And then they may even present with weight loss or weight gain, depending on the type of diabetes. Type 2 diabetes is the real common killer these days, and be a silent killer, I would say, because people don't realize sometimes that they're actually having diabetes because they don't get tested enough. They don't go and have the urine tested or have a simple blood test these days, where they can have where we can detect diabetes at an early stage.
That's such really an important reminder, that your skin is telling us early warning system, often showing signs before someone even knows they have diabetes. So you've been also quite vocal about connecting what's happening on the skin to what's happening inside the body. So why is that message so important to you?
In terms of because of inflammation,
Mhm.
because chronically high blood sugar levels will damage the small blood vessels. And when they damage the small blood vessels in the body, this leads to poor circulation, dry skin, delayed healing, and the risk of infection. So that's why if we can control diabetes, stop the levels of sugar rising, educate people to lose weight, exercise, and improve their overall condition, this is going to help them in terms of longevity and future health span.
And of course, we really have to look for ways on how we could stop. I'm sorry, we have to look for ways on how we could. It's all about prevention. You're not just treating diabetes, but you're teaching people how to stay ahead of it, which feels really like a game changer. But how can they distinguish between ordinary skin problems and those that might be diabetes related? Because, like even people who don't have diabetes, they might have skin issues.
Mhm. Okay. Common things people should look out for usually is a dry, itchy skin.
Mm-hmm.
And, and also they tend to get recurrent fungal infections. Sometimes they may present with these dry, velvety patches around the neck area, or which we call acanthosis nigricans. And also, say they have a cut, for instance, and the cut takes a longer time to heal, or they may have recurrent boils, and these are skin infections. Or sometimes patients may present with recurrent infections in the genital area, especially males. They may have what we call balanitis, and this is really due to thrush. And thrush is a common sign, or occasionally they may even present with oral thrush. So these are sort of common recurrent symptoms, and patients should take heed of these and look and seek for help.
Mm-hmm. And what preventive steps do you recommend for people managing both diabetes and skin health?
Well, as soon as patients realize that, well, number one, I would say it's probably think of weight and diet. Those are the
Mm-hmm.
most commonest things. So look at your weight. If you find that your weight is increasing, you find that your diet is poor, all these things can be addressed quite easily, and you can reverse type 2 diabetes by simply controlling your nutrition and eating healthily and having proper food in terms of vegetables, less fat in your diet, and all these things will help in the end to improve and control your diabetes, rather than eating food which is going to cause excessive weight.
That's such really a practical way, Dr. Sadhu. Sometimes people assume managing diabetes has to be complicated, but it really does start with what's on your plate. But beyond nutrition, daily habits can also make a difference, especially when it comes to skin. Are there any specific skincare routines or ingredients you find especially helpful for diabetic patients?
Using ceramides in the skin is really
Mhm.
important. That helps to keep the sugar levels down. It protects the skin and keeps the skin hydrated. We're really looking to keep the skin hydrated. Although diabetics sometimes may even present with oily skin, but if we hydrate the skin with proper ceramides, this will really help to improve the natural texture of the skin and prevent cuts and blisters, etc.
Mm. Now, Dr. Saito, I'd like to move to your advocacy. We briefly mentioned earlier your Man Strong 2. You've been encouraging men to take proactive steps in their health. So, why do you think men in particular often delay seeking care for issues like diabetes?
Men on the whole, for some reason, have this macho effect.
Mm-hmm.
They think, well, I'm strong, I can last forever. And going to the doctor is seen as some sort of a stigma for them. And people don't really like to approach the doctor, and they leave it until it's too late, or the wives suddenly realize there's a problem, and then they urge the patient, or they go and even make an appointment for the husbands to attend. But men on the whole, they tend to delay for some reason, and they just don't like to attend. But ideally, the aim of the program is to encourage these men. Look, you've got a problem. You're tired. You're suffering with fatigue. You may have loss of libido. You've got home life is suffering. You're not being intimate with your partner, and you find that your work is also suffering. You're not as productive at work. So you have a hidden condition going on, and you need to take action. Because if you don't take action now, this is going to become worse in the future, and you'll end up with real complications with diabetes, such as heart attacks, strokes, kidney failure, skin conditions leading to amputation of your toes, especially if you're diabetic. So a lot of these things need to be addressed at an early stage, and we need to be more proactive rather than being reactive.
Absolutely, and of course, Dr. Naidoo, it's such a familiar pattern among men. It's not just about health, but it's also about mental. It's not just physical health, but it's also about mental health. I have a few episodes talking about mental health among men and why they tend to be reluctant seeking professional care. And
Yes.
it really shows why awareness and early action is so critical. And on that note, I believe that men strong too. You're involved with advocacy. You're involved in campaigns. Are there any specific campaigns that you're working on at the moment?
So now, in terms of campaigns,
Mm-hmm.
we are looking at different campaigns at the moment. We're looking at trying to get the word out there. We're looking at doing some campaigns doing some webinars on Man Strong 2, where we can talk to patients and give them education about the diabetes in terms of the skin health, because really your skin is so important in terms of general appearance, gives you an early sign of infections, because your skin reflects what's inside yourself. So a lot of these things need to be educated. We need to educate patients about the skin. So Manstrong 2 not only looking at diabetes from a cardiovascular point of view, but working with Dermoy, for example, with the company which I'm also started to work for the last couple of years, has really given me an insight on how we can educate patients, give them honest opinions on various products out there which we can use to help them with the skin.
Absolutely. And thank you for bringing Demois, because that's actually my next question to you, Dr. Naidu. We both recently joined the scientific advisory board of Demois, which focuses on evidence-based skincare. So how do you think the scientific approach align with your own philosophy? And I'm talking about the approach of Demois. How does their approach align with your own philosophy, with real world health education that you're doing with Men Strong?
Yeah, it absolutely aligns perfectly. It's
Mm.
100% alignment because what we need to show public that we have trust and to gain trust of the public, and we are now giving them real scientific advice on the products which Dermo uh, are actually assessing. So from that point of view, I know that when I recommend products which have been assessed by Dermo, I feel confident that these patients will get real benefit rather than buying something over the counter, just giving you false information, and patients are becoming dissatisfied and not really seeing the real effects of the treatment. But certainly from my point of view, um, joining Demoy, attending the recent scientific advisory board was absolutely it was absolutely amazing because we really got to meet some really like-minded people, uh, for example, like yourself, and also to actually understand the different perspectives of how people address, people's health.
Absolutely. And Dr. Naidu, looking ahead, how do you plan to continue expanding awareness through your initiatives like Man Strong 2 and being a member of Demois Advisory Board? Do you have any other future plans?
Well, I like to do more webinars on this and
Mm-hmm.
educate patients.
Mm-hmm.
Maybe do an article in the press if that's
Mm-hmm.
possible, and also working with them itself, getting my message out there, because end of the day, your skin can speak before your blood test, or
Mm-hmm.
and so it's important to listen to your skin, look at your skin, and inspect your skin on a daily basis for different types of conditions, not only for infection, but you can also do simple things like for skin cancer, look at moles, etc. So your
Mm-hmm.
skin actually talks to you before you actually have the disease. So one should be really critical about this and really look at this in a scientific way, not just an aesthetic point of view.
Yes, that's really an important point to remind everyone that sometimes we think looking after our skin is just vanity, or just looking for these like rashes, that thrush that you've mentioned is just vanity. But like what you've mentioned, it could be it could be a cause of something more serious, such as diabetes. um Lovely talking to you, Dr. Suren Naidoo. But before we wrap up, let's end on a lighter note with some quick fire questions to get to know you a bit better. So,
Sure.
Dr. Naidu, what were you afraid of as a child?
As a child, oh, lots of things. I think where I grew up on a farm,
Mhm.
and this is back in South Africa. And really, I think nighttime was the scariest thing because where we lived was quite isolated, desolated sometimes. And any knock on the door at night would terrify me, thinking we've been burgled. Although we had guard dogs, I mean, the dogs would be, you know, would probably, I don't think the dogs would actually do anything. They were so docile. But yeah, grew up as a child on the farm, can be quite scary at times because where we lived was quite isolated.
Mhm. And what is your favorite word in another language?
Well, you wouldn't believe this, only speak English.
Okay. So, do you know any expressions in Spanish or French?
Well, France, je t'aime.
Okay. And well, Denwa sounds French, so maybe you could like
Yeah,
add that to your foreign vocabulary. Now,
foreign vocabulary.
yeah, if you hadn't been doing what you're doing, what would you have pursued in your life?
Well, I, I think if I, because of my background to go into
Mm-hmm.
medicine, my parents were in medicine, my parents' family were in medicine. I think I sort of gradually sort of slotted into the shoe, as it were, and just carried on doing the same thing. But I think if I hadn't done medicine, I'd probably wanted to do law. I think that's the next challenging part for me. I'd love to do law.
And finally, the floor is all yours. What should people take away from today's conversation?
Well, I think the most important thing from today is, look, your skin is the biggest organ in the body.
Hmm.
Look after your skin. As I said to you, your skin can speak to you before you see signs and having blood tests and so on. So protect yourself from the sun in terms of skin damage, where you might develop cancers in the future. Keep well hydrated, eat well, and look after your health, because your health, once you lose your health, you cannot regain that health again. So it's important to exercise, eat well, have good nutrition, and improve your longevity, improve your health span, so that your lifespan will be much more fruitful in the future.
Yeah, and of course, you could spend more time with your loved one. That's a fantastic note to
Sure.
end on. Your insights into diabetes, skin health, and men's wellness have been truly eye opening. Dr. Suren Naidoo, it's been a real pleasure having you on the DRH show, and I look forward to seeing your work with Man Strong and Dermwa continue to make a difference in men's health awareness. Thank you.
Thank you, Dennis, for inviting me. You're welcome. Bye bye.